Welcome back, viewers. Today what we'll be dealing with is calving management, and we'll be looking at signs before calving. Now, cows generally calve at roughly 290 days roughly after conception. At about 7 to 8 months, what you'll find is that the udder will start to fill out. As the calf approaches, the teeth becomes distended and full. At 7 to 10 days before calving, the vulva will expand and may change in color. The swollen vulva may discharge mucus. The cow at this stage will try to seek to create a bedding material or install, and as such shall not be disturbed during these times. When she starts to calve, what will happen is that she will arch her back and strain, and at that same time you will see two things happening. The first water bag and the second water bag will actually burst. The calf's two front legs will appear if the birth is proceeding normally. The cow should not be disturbed, but should be allowed there to calve naturally. If you look at the cow about every 30 minutes duration, that will be fine. The picture that will flow will show you the cow that is about to calve naturally, the presentation at which a calf is placed within the uterus or within the confines of the animal's body. A little difficulty we experience in the fields, though, is when this position is changed and when there is abnormal calving. Most cows do, however, experience these troubles. If calving is not proceeding normally and it extends beyond 4 to 6 hours, then it's recommended that we seek veterinary attention. Most times what will happen is that the cervix is fully dilated and the three essential parts of the calf can be felt in proper position. That is, the two forefeet and the head, and the two hind legs and tail. Now, attempts can be made to pull the calf out. However, prolonged calving can cause the uterus to tire and stop contracting, and then there's the danger of the uterus rupturing. What we're about to show you is basically two such presentations, where one, the breech presentation, where the hind legs are forward, and then what will happening is we have to fix that situation. And then the other one, where the cow is turned with the four legs placed upward. These two pictures will clearly demonstrate the difficulties that we're speaking about. Once the calf has been born, we need to allow the mother to clean her up. If the mother is too weak, then the calf should be cleaned up by the farmer or an experienced personnel. Mucus, which is around her nostrils, we should attempt to clear it. At the same time, turn the calf upside down to allow for proper drainage at that point. Now, after calving, there are some things that we need to consider. Even though the cow will attempt to lick to clear away the calf, it will attempt to allow the calf to suckle. And so, we should avoid handling the calf between the first 12 to 24 hours while the mother is actually recovering from calving. If the farmer handles the calf before the mother, his smell will be transferred to the calf, and as such there will be some amount of rejection because the mother will not accept the calf as her own. The calf must be allowed to suckle adequate colostrum within the first 2 to 3 days, as this will provide passive immunity to the animal. Now, the picture to follow will actually demonstrate the animal being given a chance to suckle its young. And it's advisable that this suckling happens within an hour to an hour and a half after calving, if the animal is actually strong. After the calving has been successful, the next basic consideration has to do with the afterbirth. Now, which we commonly refer to as the placenta. which is usually dispelled within a few hours and is expelled within actually roughly 12 hours, or the greatest extent 24 hours. It is defined as a retained placenta if it is said to have not been cleared after or beyond 24 hours. If the placenta does not come out naturally, it should be left alone and not pulled out. Pulling the afterbirth can also cause hemorrhage, and a cow could bleed to death. We should check every 12 to 24 hours and to see if necessary interventions would have to be made in order to assist the animal during this period, because a retained placenta would usually increase the time from calving to the next conception. A cow with retained placenta may well delay the next pregnancy for 2 to 6 months. If the cow, the calf is born dead, what would happen is that we need to clean the cow up immediately if possible. If the cow is sick, you need to give antibiotics within 3 days and then provide an intrauterine bolus to assist with the conditions. The following pic will show you what happens when you look. You will see the retained placenta being depicted on the cow.